the real advantage of this invention will show, I think, within the next year, because we have an ongoing multi-center study for this lens, and but we believe, and that's why we started to use this lens last year already, that the centration of this lens will be better, and due to this, perhaps also the refractive outcomes will be stable and better than in a normal IOL. And I think this goes together with the femto laser procedure. And I think one of the most advantages of the femto laser cataract surgery is the perfectness of the rhexis, of the capsulotomy. And so when we have a perfect rhexis, why shouldn't we have a new IOL design which uses this perfect rhexis with a planned diameter that occurs in every patient that we have, to make a new step towards a new IOL technology. So for me, it's an absolute logical step to change also the IOL design if we have a perfect capsulotomy of a perfect planned diameter in every patient. And I think there will also be new designs, new multifocal designs, and we have also the opportunity to have toric IOLs, where we have less rotation, more stability in the capsular bag for the toric IOLs, and I think these are advantages that should be very promising for us. So we use in our clinic Mydriazert from TH Pharma, which is a very good device to make always a very big pupil. So it's absolutely rare that we can't have a capsulotomy diameter smaller than 5. And so the pupil diameter a little bit above 5 millimeter is enough for a good capsulotomy of a diameter between 4.8 to 5 millimeter, which I think is a very good diameter for the FEMTIS IOL to clip the additional haptics into the capsulotomy. It is very often discussed that the irrigation aspiration is more difficult, but I can't recognize it in my patients, and I don't see a big difference between standard phaco emulsification and femtolaser cataract surgery. No, for me it's just the same. I don't see a big difference between the irrigation and aspiration of the remaining cortex in patients with femtocataract surgery and in standard traditional phaco emulsification. For me it's just the same. I can't see in my experience that there is a difference, that it is more difficult in the femto patients. I haven't used a lot of devices for iris registration. We know how important it is, especially when you think about the LASIK treatments. I use the Schwind platform, and since we have there the cyclotorsion control, it shows that the outcome is much better. And so I think that also in our patients in the cataract surgery, where we have the iris registration, it must bring an advantage. And as you could see in the patients we show, the iris registration works very well. In my patient there was a little bit problem because there was too much bubbles, and I think that was just because it was just the live surgery, and it's very often that there is something not running as good as in the normal procedure. So in the patients in my clinic where we treated with iris registration, we couldn't see this problem, and the iris registration works so fast, and the data that come from the Cassini are so perfect that the iris registration works well, and then we have a very good result for the egg case. For the arcuate incision, it's very easy. There are to open with a normal spatula, and that's very easy. You can see it in the video. It's always very fast, easy, and reproducible, and it's always so easy because you are in the diameter from the center 4 to 4.5 millimeter. There we have a clear cornea there, and it's very easy to open. I think the manual approach is not as precise as the laser incision. You could see the laser precision takes you only half a minute more in your whole procedure. It is very easy to plan, and so it is easy to open, and if you have a good normogram for that, then you will have also very good results in moderate astigmatism. So we have a restriction of a pupil diameter of 4 millimeters. Above that, we have to use, for example, instruments to make the pupil wider, for example, the Augenklinik rings. I don't have experience with that myself, and it's, as I told you before, it's absolutely rare that we have so small pupils. But pupils with a diameter of 4 are very good. It's easy to perform with a laser, the perfect capsulotomy. And I think even in the small pupil cases, it's more safe because in a standard manual capsulotomy, everybody knows that it's often not so easy to make a capsulotomy manually, and so the laser will do the capsulotomy automatically in the perfect diameter, which is as big as possible in the pupil diameter.